working in partnership with the criminal justice agencies. Give them a few minutes to sort themselves out. Councillor Zaffar, it's up to you to move.
Thank you, Lord Mayor. First, I'd like to thank both the Social Cohesion and Community Safety and Health and Social Care Overview and Scrutiny Committees for their time and effort in carrying out this important inquiry. We decided from the outset also to include a service user rep and a carer governor from the Birmingham and Solihull Mental Health Foundation so that the user's voice can be heard. I'm grateful to Maureen Johnson and Linda Smith for their contributions and to the Birmingham and Solihull Mental Health Foundation Trust for their support. I'd also like to thank the officers, Basima Begum and Rose Kiley. We took evidence from across the communities of Birmingham. I'd like to thank everybody who took the time and trouble to contribute, particularly Jeff Coleman for enabling our online community to contribute to the evidence gathering. I'd also like to thank the executive, in particular Councillor Bedser, for his support. This was a sobering inquiry. We learned that mental health problems cost the UK about 110 billion a year. Suicide is one of the leading causes of death in young people and adults. Yet in Birmingham, young people between 16 and 18 get no statutory mental health support. Lord Mayor, this is scandalous and must change. At the time of our last full council meeting, 56 leaders from Citizens UK Birmingham, a broad-based alliance of faith groups, educational institutions and unions, shared testimony, a song and mince pies with the board of the Birmingham Cross City Clinical Commissioning Group as a public action to ask for better quality mental health services for 16 and 17-year-olds in the city. Currently, under-16s can have access to specialist services from the Children and Adolescent Mental Health Services, while over-18s are covered by the Birmingham and Solihull Mental Health Trust. Lord Mayor, this leaves vulnerable 16 and 17-year-olds with no access to specialist mental health services from the NHS. That's just not good enough. So we call on our city's health leaders, in particular the 3 CCGs, to make sure that all young people get the mental health services they need. I'm informed that the chairs of both the Birmingham Cross City CCG and Sandwell and West Birmingham CCG support this ask. So we look forward to the backing from the 3rd CCG, Birmingham South Central, and seeing the support turn into actual access on the ground. Lord Mayor, 2/3 of sufferers claim the discrimination they face is worse than the illness itself. Fears and stereotypes need to be challenged and overcome. We need to address the revolving door of service users being discharged but then readmitted due to inadequate support. Nevertheless, much good work is being done in Birmingham against this difficult background. West Midlands Police is by far the most proactive force in the country, now taking a national lead on many aspects of mental health work. The debate around the role of criminal justice agencies with respect to mental health in the West Midlands was triggered by the Office of Police and Crime Commissioner at a summit hosted by Bob Jones, Councillor Yvonne Mosquito and Chief Inspector Sean Russell, and supported by the Cabinet Member for Health and Wellbeing, Councillor Steve Bedser. Inspector Michael Brown of the West Midlands Police, known widely as Mental Health Cop on Twitter, is leading nationally in ensuring police forces up and down this country are equipped to support those with mental health problems. Lord Mayor, this needs to be supported and embedded across the board. Birmingham City Council's appointment of a mental health champion, Councillor Paulette Hamilton, during the evidence taking of this report has been well received. The City Council needs to follow this through by implementing our recommendations. Training of frontline staff is also essential. Inadequate training just sets staff up to fail, and that's not fair. Historically, police officers have had only 4 hours of training on mental health before being inducted. Yet many senior officers see mental health as a core element of policing. The training now needs to reflect this. Good training, especially from those operating within the criminal justice system, entails an awareness of cultural sensitivities, particularly when it comes to mental health. The needs are twofold. First, culturally sensitive training for magistrates, police and prison officers and other professionals dealing with people experiencing mental health issues. This could be part of an induction process delivered by third sector partners. Second, the presence of a third sector worker at police stations and in prisons able to provide language or cultural support will be a positive step forward. There's also a lot of confusion about how to get help. A one-stop public helpline similar to NHS 111 would go a long way to help those seeking support, as well as offering guidance and access to referral information for officers not working in mental health. There are inequalities impacting upon BME groups that we need to address. The overrepresentation of African Caribbean young men in mental health and in the mental health and criminal justice systems needs to be tackled through targeted work by all agencies. During evidence gathering, members heard specifically about the need to deliver mental health services fairly to all communities, ensuring that stereotypes aren't allowed to skew the diagnostic and treatment system. For example, we heard that black people are 9 times more likely to be admitted to hospitals in England and Wales than the rest of the population, and that they make up 15% of the prison population compared to only 3% of the general population. Yet African Caribbeans do not have a higher prevalence of mental ill health than any other ethnic group. Likewise, the underrepresentation of South Asian women accessing services also needs to be tackled. The proportion of Asian mental health patients is a third lower than the proportion of Asian people in the population. Clearly, they don't come forward enough, but we're almost certainly also not delivering the right services in the right way either. Probably the report's key finding is that we need to improve access to support for everyone at the earliest possible stage. Once sufferers have entered the criminal justice system, it's often already too late. We need to support small community groups in the heart of our communities, providing a befriending arm around the shoulder service to those who have no one to turn to. Lord Mayor, currently the most vulnerable people in our community are being stigmatised, victimised, stereotyped and let down. That's not the kind of city we want to be, not the kind of people we are, so it's got to change. I move this report. Thank you, Lord Mayor.
I call upon